Speed fix is a technique designed to repair small tears of the rotator cuff. If the torn rotator cuff is not repaired, arthritis may develop in the shoulder. The surgeon begins by identifying the tear in the rotator cuff tendon. The cuff is brought over to its original attachment site to ensure that the repair can be completed without tension. A burr is used to create a spot on the humerus where the cuff will heal. Once the bone and soft tissues are prepared to reattach the cuff, the surgeon uses a multi-fire scorpion suture passer to place suture through the rotator cuff from the bottom to the top. This special suture passer allows the surgeon to reposition the instrument prior to passing the second suture. The sutures are then retrieved and stored inside a cannula. The surgeon then creates a single bone socket lateral to the prepared bone. The sutures are threaded through an anchor, and the anchor is then placed in the bone socket. Sutures are tensioned, and the anchor is screwed into place. Excess suture is trimmed with a cutting device. The rotator cuff repair is complete.